Hi guys, I'm back with my new topic, tort. It is a kind of law issue in nursing practices. As we know that in nursing there are many ethical and legal issues which are required for our safety and for the patient's safety. So there is one kind, tort, which will be discussed in this video. So start. What is tort? It is a civil wrong made against a person or the property. That is, any mistake or the wrong done by a healthcare provider can be issued by the perspective of torts. There are different types of torts: intentional, quasi-intentional, and the unintentional torts. So let's begin with intentional tort. Assault, battery, and the false imprisonment are the kind of intentional tort. In assault, any intentional threat to bring about harmful or the offensive contact. It is a kind of threat only. The healthcare provider or the nurse only threaten the individual or the patient. It doesn't touch the body. Example: threaten a nurse to give a client an injection. And next is the battery. An intentional touching of another's body without consent. That is, a battery always include an assault because it is a kind of threatening with touching the body. So this is the difference between the assault and the battery. Next is the false imprisonment. In the false imprisonment, there is an unjustified restraining of a person without legal warrant. Example: if a client is not allowed to leave a hospital when there is no legal justification to detain the client. So this is the example of false imprisonment, where there is a restraining of a person. Next is the quasi-intentional type. In this, invasion of privacy, that is violating the confidentiality of the individual. Next, defamation. It is a false statement that causes damage to a person's reputation. In defamation, we cause a person reputation damage. It is a kind of quasi-intentional tort. There are two types of defamation. Either it can be libel or slander. In libel, there is a defamation by written statement. In slander, it is a defamation by the verbal statement. Next is the unintentional, that is a violation of standard of care tort. It includes malpractices and the negligence. Malpractices, it is one type of negligence where like nurse owed a duty to the client. Nurse did not carry out the duty and the client was injured. That is a kind of malpractices. Next is the negligence, in which a nurse conducts that falls below a standard of care. It includes acts of commission and the acts of omission. Some examples are failure to assess or monitor, failure to follow orders and the 6 rights of drug administration, failure to follow the policies and procedure, error in giving medicine and the IV infusion. These all are the kinds of or the example of the negligence, which is the kind of unintentional tort. Thank you. This was the all video about tort.